So these are the take-home messages. Throughout the pandemic, the Western countries had 5 to 10 times higher mortality from COVID-19 compared to African countries, Asian and African countries, with few outliers. What are the outliers? We have seen Japan is an outlier and Brazil is an outlier and South Africa is the outlier in each continent. Age and more importantly, obesity as measured by BMI was strong predictors of this different irrespective of vaccination status. So what this data is trying to point out is vaccination does prevent, say, severe disease or hospitalization at an individual level, but at a country level, at a population level, other factors like your country-wise obesity, your country-wise age you can't change, but obesity, lifestyle, diet, you can definitely change. You can have better services for diabetes control and hypertension and other comorbidities. So those are perhaps more important than just vaccination. Vaccination is just one of the tool, but it cannot be the only tool in your strategy because the country-wise data does not show that. Japan, Brazil, South Africa outliers in the continent in spite of high age, lower obesity, as I have said. In Japan, opposite was the case in Brazil. Obesity per se reduces lung function and is also a surrogate marker of other comorbidities. All these are related to lifestyle factors like physical activity, diet, tobacco, alcohol, stress, and studies so can cause excess deaths. So, in fact, there are studies which show that if you just control obesity, or obesity can explain 70% of the excess deaths from COVID. 60 to 70% of obesity, and the second factor which was found on a large scale data mining was the anxiety levels of population and obesity levels. So if these two things together can account for 70% of deaths from COVID. And you see vaccine efficacy say 90%, now they say after 3 months it is 50%, after another 3 months the vaccine efficacy is 30%. So if your obesity at a population level is controlled, you get a better protection than vaccine, which does not diminish with time. Vaccine, it diminishes with time. You can't afford, large country like India particularly, can you afford every 3 months a booster? Such a large population. And when you are not getting the bang for your buck, when your other countries which have had much larger population vaccination coverage are having higher impact of deaths, even developed countries. Why? Because they are obese. Why? Because they are age of course you can't change, but obesity was a bigger marker. See, Japan is the best example that in spite of the highest age, they are having much more low mortality.